In this simulation, you will learn how to order vaccines that are due for the patient and complete the details for the vaccine order. To order vaccines for the patient, click the New Order button. Because this is a pediatric patient, the Create New Immunization Order window opens for the pediatric favorite vaccines. Let's select the DTaP HIB IPV vaccine. Since I turned on the Require Allergies Review Before Ordering option in the Immunization tab of the Orders module Practice Preferences, the Review Allergies window opens. I will document that the patient has an egg allergy. Let's save. Because DTaP HIB IPV is a combination vaccine, you select it under DTaP DTP. The system automatically selects it under HIB and IPV OPV. I went ahead and ordered the Hep A vaccine for the patient as well. Let's move on to the vaccine details to complete the order. Because I selected the Prompt Radio button for VIS Print Mode option in the Immunization tab of the Orders module Practice Preferences, the Print VIS window opens to remind me to print the VIS document for the patient. Let's print these VIS documents. To enter the details for the DTaP HIB IPV vaccine, click the lot number field drop-down. Select the first lot number. Since I entered the details for the vaccine when I set up the inventory in the Vaccine Orders System Master file, most of the fields for vaccine details are populated automatically. You can fill out the rest of the fields if needed. For example, I will record site and consent information. Because you have provided additional counseling of vaccine risk and benefit for the DTaP HIB IPV combination vaccine to reflect and capture your work associated with the administration of this vaccine, click the Counseled checkbox. Click the Refresh button. You are prompted about changing the CPT-4 code. Click Yes to proceed. The admin CPT-4 code has been changed to reflect the counseling work from the provider. Notice that when the vaccine details are entered, the status is updated to completed. I went ahead and entered the details for the Hep A vaccine. Let's save and close the window. If the patient had adverse reaction for a vaccine, you would report it to the Vaccine Adverse Event Reporting System, VAERS, website. For example, if the patient had a serious reaction for the Hep A vaccine, you would double-click the date for Hep A. After you reviewed the vaccines included in this order, click the Web Links button. Select VAERS. You can follow the steps on the VAERS website to report a vaccine adverse event. Click the Close button. To preview the immunization history before printing it out, click the Print button down arrow. Select Print Preview. The immunization summary report opens. After you review the report, click the printer icon. Click the Close button. You have learned how to order a vaccine for a pediatric patient. In this simulation, you will learn how to order VFC vaccines for an eligible patient, record a wasted vaccine, and document immunity for the patient. Click the New Order button to begin. Select the General tab to check the patient's current medical insurance for VFC vaccine. Because the patient is uninsured, she is eligible to receive VFC vaccines. To select a VFC program, click the Registry drop-down arrow. Select PACES. Click the VFC Reason drop-down arrow. Select VFC Eligible Uninsured. Let's go to the Select Vaccines tab to order the vaccines. Click the DTaP HIB IPV checkbox to select the. I went ahead and documented that the patient does not have allergies. I have selected the Hep A, rotavirus, and varicella vaccines for the order. In this example, the provider will save the order and the nurse will log in and administer the vaccines for the patient. Let's save the order. You are prompted that rotavirus should not be given because of the patient age. Click the Cancel button to remove. Notice that the vaccines have been ordered and the statuses are listed as pending in the chart view. Let's log out of EHR. Now I logged in as a nurse. Select the Orders tab. The vaccine order is listed in the Orders tab. Double-click the order to open it. Click the Print All button to print all VIS documents. Select the VFC Reason drop-down arrow. Select VFC Eligible, Uninsured. Click DTAP HIB IPV to select the vaccine. Click the Lot Number drop-down arrow. Select the VFC lot. The vaccine details are populated. I document the site and consent information for the vaccine. Click Hep A to select the vaccine. I went ahead and selected the VFC lot number for Hep A vaccine, but before I administer the vaccine, I accidentally broke the vial and wasted the vaccine. To document the wasted vaccine, click the Date field to record the date. The system automatically inserts today's date into the field. Click the Reason drop-down arrow. Select Drop Vial, Broken Vial. Click the Save Waste button. You are alerted that the details for the vaccine will be reset. Click Yes to proceed. I repeated the process and administered the Hep A vaccine for the patient. Let's move on to the varicella vaccine. The patient's mother recalled that she had chickenpox a few months ago. The patient does not need to have varicella vaccine. Select the Excluded radio button. To enter a reason for excluding this vaccine, click the drop-down arrow. Select Other to enter a reason. I entered the reason in the field. To record that the patient has immunity for varicella, click the Immunity drop-down arrow. Select varicella. Let's save and close the window. The vaccine order is now shown as completed in the orders list. Select the Immunizations tab. In the Immunizations chart view, the varicella vaccine is marked as excluded and the status is shown as current because we recorded the patient's immunity for varicella. You have learned how to order VFC vaccines for a patient, record a wasted vaccine, and immunity information. In the simulation, you will learn how to exclude vaccines for a patient. In this example, let's exclude influenza vaccine for the patient due to his egg allergy. Click Influenza to select the vaccine. Click the Exclusions button. The Vaccine Exclusion form window opens. Select the Allergy checkbox. You can set up an effective date range for the exclusion and enter additional information for the exclusion in the comment field. Click the Check All button to exclude all influenza-related vaccines. Click the Search Vaccines button. If needed, you can search for vaccines to be excluded. Click the Cancel button. Let's save the changes. To document the vaccine series that were completed, select the Series Completion tab. For this patient, all series are completed except for influenza. Click the Check All button. Click the Influenza checkbox to clear the selection. Let's save and close the window. Once you set up the exclusions for the vaccine, it will not be available to be ordered for the patient. Click the New Order button. Notice that the checkboxes for flu vaccines are disabled to prevent being ordered for the patient. Let's close this window and return to the chart view. To cancel the influenza vaccine exclusion for the patient, select the vaccine and then click the Exclusions button. Click the Check All button. Click the calendar icon within the End Date field. I will pick a date on the calendar. Let's save and close the window. Now let's access the Create New Immunization Order. Notice that the checkboxes for flu vaccines are enabled for the patient. Let's order the flu 6 to 35 months vaccine. Select the Vaccine Details tab. The Drug Interaction Flu Split 6 to 35 months window opens. Click the Reason drop-down arrow. Select Patient Aware of Interaction. Click the Acknowledge button. Click the Done button. You are prompted again to administer or exclude the vaccine. I want to show you how to exclude the vaccine on the Vaccine Details tab, so click OK to administer the vaccine. You can exclude the vaccine here by clicking the Excluded Radio button. If needed, you can enter a reason for the exclusion by clicking the drop-down arrow. Let's save and close this window. In the chart view, the influenza vaccine is now marked as excluded. You have learned how to exclude vaccines for a patient.